And do you feel we are ready and equipped to have, cashless medical institutions, transactions at least?
Well, we're sitting here in the first week of December. If you'd asked me that question a month ago, I'm not sure what I would have said. But I can tell you now, we better, right? We all need to, with the demonetization that's taken place. And listen, we're talking to all the key players in the space who have platforms. There's the Paytms of the world and the MobiQuicks of the world. We're talking to the credit card holders as well. We're moving in that direction very, very quickly, right? I mean, there are scooter wallahs now who you can just scan your card and pay, so that's completely cashless. So I think that we're headed in that direction. We're running. We need to run because we need to provide good quality care. I think if it was 2-3 months ago, we might have had a choice. I don't think anybody has a choice. So you have a choice, which is either get on the bus or miss the bus altogether. So we're on the bus, we're in the front seat, and we'll be making all sorts of platforms available.
And do you think profit and healing go together when you say margins will be increasing?
Absolutely. I think one enables the other. Because the reality is, and this is public information, Fortis is not profitable. If you're not profitable, how can you invest? How can you invest in technology? How can you invest in equipment? The best hospital operators in the world are some of the most profitable hospitals in the world. And we're investing in research, we're investing in trials, we're investing in new equipment, new technology, new infrastructure. I think that clearly, if the only thing that Fortis stood for, or any organization stood for, was about making money and nothing else, then I think you should be held accountable for that. Having said that, in the last 15-20 minutes, we've talked about medical equipment technology, we've talked about investment, we've talked about raising awareness on breast cancer, we've talked about organ donation. If we do all of these things, we talked about research and trials, it's only having a viable business model that supports those things. The reality is that if we were not making a profit, we couldn't do any of those things. And then the question you'd be asking me is, why aren't you doing those things? So I think one enables the other, and actually they go hand in hand, and that's not a bad thing. I think the idea is that continue to be good for the country, continue to help build a healthier nation, a more knowledgeable nation, and then I think it makes a lot of sense, and then I think they do go together well.